Hi, my name is Courtney Austin. I'm a nurse practitioner here, and I'll be doing your exam today. How are you?
Good.
Great. What are you coming in for?
Just general wellness check.
Okay, great. I'm happy to do that for you. First off, I do want to ask that the medical assistant obtain your vitals, including your height and weight, prior to coming in.
Yep.
Okay, great. I'm going to just grab some hand sanitizer first. Feel free to partake if you want. And I will note that speaking with you, I noticed that your cognition is intact. You drove yourself here, you're in a calm demeanor, and you are able to answer questions appropriately. So moving on with the exam here, I'm going to start by noting your skin integrity to your face and head is intact and appears warm and dry. Hair appears clean. I'm going to palpate your scalp here. Any tenderness?
No.
No nodules are present. No infestations are present. Moving on, I'm going to check your trigeminal nerve. By doing so, I'm just going to palpate here. Any tenderness?
No.
Okay. I'm going to have you open your mouth and close, and then clench your jaw. Great. And then move your bottom jaw side to side. Great. No clicking noted. Any pain or tenderness when we do that? Okay, great. Trigeminal nerve is intact. Next, we're going to do your facial nerve. I'm going to have you raise your eyebrows and then relax. And then I'm going to have you smile real big. Great. And then relax. And then I'll have you puff out your cheeks. And then don't let me push air out. Great. Facial nerve is intact. Moving on to your eyes, I will note that there is no drainage coming from your eyes and your sclera is white with no redness present. They look symmetrical on your face. I'm just going to assess your lacrimal duct here by palpating. Any tenderness or pain?
No.
No? Okay. And no drainage present with that. I'm going to check your conjunctiva by pulling down, and your conjunctiva is pink and moist. From there, I'm going to check your pupils. I'm going to shine a light in both eyes here. Great. Left is round and reactive. Left is round and reactive. Left is round and reactive bilaterally. They constrict with light. They're equal round reactive, and I'm about a size 3 right now. From there, we're going to do the corneal light reflex, which I'm going to shine the light between your eyes, and then I will check for corneal light reflex is intact and noted bilaterally. Next, we're going to do the cover on cover test. I'm going to have you cover your right eye with your right hand, and then lower. And then left hand, the left eye, and then lower. Great, no wandering noted. Muscles appear intact. Next, we're going to assess your cranial nerves 3, 4, and 6 by doing the 6 cardinal fields of gaze. We're going to do an H pattern. So I'm just going to have you watch the tip of my finger and then follow it where it goes, not moving your head. Perfect. Accommodation is intact as well. Next, we're going to do the fundoscopy exam here. We'll be assessing for the red reflex. And then I will be looking at your optic disc, your retina, and your vasculature. Red light noted. And then I'm going to get kind of close, so pardon me. I'm going to put my hand on your shoulder, and then I'm just going to take a quick look. Optic disc noted, vasculature intact, no leaking present, and retina noted. I'm going to do this side. Red light noted. Optic disc present, vasculature intact, no leaking noted, and the retina is intact. The retina is noted. All right, great. Moving on to your ears, I will note that your ears are symmetric, and the pinna is in line with your outer canvas of your eye. Any trouble hearing lately or anything?
No.
Great. I do want to mention that the medical assistant will be checking your acoustics. They will be doing the Whisper, Weber, and Riney test after this. But for now, I'm just going to check out and see if there's any pain when I feel here.
No,
No? Okay. Any pain or tenderness?
no.
Okay. We're going to look at your ear canal. Okay, and then pull out. All right. No redness or bulging noted. Your tympanic membrane is pearly gray, and their cone of light is at 5 o'clock. No redness or bulging noted. Tympanic membrane is pearly gray, and your cone of light is at 7 o'clock. Okay, moving on to your nose. Any difficulty smelling lately?
No.
Okay. If you did have any difficulty smelling, what we would do is we would have to check out your olfactory nerve to make sure that was intact. And to do that, what I would do is observe patency, which have you breathe, or just check that out right now. Just have you occlude one there, and then opposite. Okay, great. Patency is intact, but we would do that, and then I would have you occlude nostril again, and then I would have you smell something that's strong but familiar, and to see if you can identify it. And then we would do the opposite side, and we would do that with a couple different things to see if your olfactory nerve is intact. But for now, I'm just going to it looks intact. There's no deviation of the septum that's obvious. I'm going to palpate the bridge of your nose. Any pain or tenderness here?
No.
No, okay, no nodules or masses palpated, no swelling present. I'm just gonna check your maxillary and ethmoid sinuses. Any pressure here?
No.
Okay, any pressure here?
No.
Okay, great. And then I'm just gonna take a peek in your nose here. All right. No deviation on the right side, no turbulence noted, and mucosa is pink and moist. No deviation of the septum on the left side, mucosa is pink and moist, no turbulence or deviation of the septum noted. Great, thank you. Moving on to the mouth. I will note that your lips are symmetric and they are pink and intact. They don't appear dry, chapped, or peeling. Your articulation of your words lets me know that your hypoglossal nerve is intact. I'm going to have you open your mouth and say ah. All right, your uvula is midline, which lets me know that your glossopharyngeal and vagus nerves are intact. One more time for me. Great, your tongue is midline, pink and moist. Your soft palate is pink and moist. Your hard palate is fused, pink and moist. Your buccal and gum mucosa is pink and moist, no lesions noted. Obvious dental work, but no positive caries right now. Have all of your teeth. Lift your tongue up for me. No masses noted. No halitosis present. There you go. All right, moving on from your mouth, we are going to assess your neck. I'm going to check your range of motion by having you bend forward and backwards. Okay, and then side to side. And then in a circle for me. Great. Range of motion is intact. I am going to check to make sure that your trachea is midline. No obvious JVD is present. I'm going to palpate your carotids, which are present and equal in rate bilaterally. I will check. I'll auscultate your carotids. Okay, no bruit present bilaterally. From there, I'm going to assess your thyroid. I'm going to do the posterior exam here. Just placing my fingers here. And then I'm going to have you just swallow hard for me. Okay, no thyroid noted or wasn't palpatable. And then we're going to check your spinal accessory nerve. I'm going to have you just raise your and then down, and then don't let me push your head. Push your head. Great, awesome. Spinal accessory nerve is intact. Moving on to your upper extremities, I will note that your shoulders and your clavicle are symmetric. Your skin integrity to both arms are intact, warm and dry, no obvious scarring, lesions, moles, or alterations noted. I'm going to palpate down your arm. Any pain or tenderness in your chromium process?
No.
Any pain or tenderness down your arm?
No.
No redness or swelling at the joint. Any pain or tenderness down in your wrist area?
No.
No. Okay. Moving on to the left side here. I'm going to assess the chromium process. Any pain or tenderness? No. Any tenderness on your elbow?
No.
Okay. No redness or swelling noted there. Tenderness in your wrist or fingers?
No.
No. Okay. Okay. No redness or swelling there. From here, I'm going to check your capillary refill, which is brisk bilaterally. And then we're going to do squeeze my hands and pull towards you. Okay, grip strength is equal and strong bilaterally. I'm going to check your pulses. Equal bilaterally, equal in rate. Brachial pulses, equal present and equal bilaterally in rate. We're going to assess your range of motion. So I'm going to have you just up, work your shoulders, out, up, down, and then elbows, out, wrist, fingers. Great, range of motion intact. All right, we are going to do your tricep, bicep, and brachioradialis reflexes. So on your right side, I'm just going to have you kind of go limp here. And then I'm going to just that. All right, muscle movement, +2 noted. And then for your bicep, +2 noted. And then your brachioradialis. All right, 2+ noted. Over here, and do your tricep. Bicep. Okay, +2, and then your brachioradialis on the left. Right. +2. Okay. From the upper extremities, we are going to do your chest. Starting posteriorly, I will note that your skin is intact, warm and dry. No obvious scarring, lesions, moles, or alterations noted. I'm going to listen to your lung sounds. All right, lung sounds are clear bilaterally, no adventitious sounds noted. I am going to percuss your lungs here. And I'm going to have you raise your arms for me. All right, percussion to the lungs posterior and laterally are dull. Next, I'm going to assess your vocal fremitus. I'm gonna, every time you feel my stethoscope on your back, I want you to say 99.
99, 99, 99, 99, 99, 99.
Great. Vocal fremitus is intact. The tones were muffled and indistinct. Next, I'm going to assess your tactile fremitus. Every time you feel my hands, I want you to say 99.
99, 99, 99.
Great. Vibrations lessened as I went down, which is a normal finding. I will note that the symmetry of the lung expansion is even. I will verify breathing for me. Great. And the shape of the back is a 1 to 2. Moving on to the front, I will notice that I will note that the chest skin is intact. No, it's warm and dry. No lesions, alterations, scarring, piercings, or tattoos noted. I will assess the heart tones. Okay, with the diaphragm, there are S1 and S2 are noted, no gallops or murmurs or extra sounds noted. Now I'm going to verify with the bell. Again, S1 and S2 noted, no murmurs, clicks, or gallops or extra sounds noted. I'm going to listen for the apical pulse, which is intact and noted. I'm going to try to palpate the PMI going down and try to visualize it. Intercostal space. Pretty spot on. PMI is intact. Unable to visualize it in this sitting position. So I'm going to percuss the anterior lungs and then I'll have you lay back, okay? So above the clavicle and below the clavicle. Okay, anterior lung sounds are dull. I'm going to have you lay back for me. And then I'm going to reassess your heart tones here before I have you on your side. And I will note that while you're lying down, I do not see any JVD while lying down. Okay, S1 and S2 noted while lying down, no murmurs, gallops, or extra sounds noted. Now I'm going to have you lay on your left side, and I'm just going to for your PM felt sitting up. I just want to verify size. Okay, great. And the size is about a 2 centimeter. So put it on your back here for me. Great. Now moving on to your abdomen, I will note that your skin integrity is great. It's warm and dry, no scarring, obvious lesions or alterations noted. It is symmetrical. It is slightly rounded, not distended. It appears soft with no peristalsis present upon inspection. I'm going to listen to your bowel sounds now. And the right lower quadrant. Great, bowel sounds are normal, active, in all 4 quadrants. Now I'm going to listen to your abdominal aorta. No brewing noted. Iliac artery on the left. No brewing noted. Iliac artery on the right. Noted. And then femoral artery on the left. No brewing noted. And femoral artery on the right. No brewing noted. Okay. So I'm going to percuss your abdomen. Okay, tympani noted. I'm going to percuss for your liver here. I'm going to start from the top and go down. Dole. Right. Tympani noted here. And going up. Tympani noted. And that's dole. So your liver's right about here. palpate. Any tenderness or pain there?
No.
Great. Now I'm going to percuss for your spleen here. Just all the way down your last rib. All right, can be noted. I'm going to have you inhale. Okay. No changes noted, so I'm going to palpate. No enlargement, because I can, oh, there it is. I can barely feel it. So if there's no enlargement, any tenderness or pain when I do that?
No.
Okay, great. Moving on, I'm going to softly palpate the abdomen. Just tell me if there's any pain or tenderness when I do this. Okay.
No.
And a little deeper.
No. No.
Okay. I'm going to assess McBurney's point here by putting a little pressure on the right lower quadrant. About third eye. Any pain?
No.
No. Okay. When I let go, any rebound tenderness?
No.
All right, great. And then I'm going to palpate your kidneys here. Looking for any facial grimacing, but I don't see any. Is it tender back here? Painful? No.
Nope.
Okay, great. Moving on, I'm going to assess your hips. I'm just going to kind of push down and up and down. Any pain or tenderness in your hip area?
No.
No. Okay, we're going to check range of motion. I'm going to lift your leg up and then out. Any pain or tenderness? Great. Same on this side. Any pain or tenderness?
Nope.
Okay, great. Range of motion intact to the hips. I'm going to have you sit up on the side of the bed for me. Great. And then looking at the knees, there's no alterations noted, no surgical scars, skin is intact, warm and dry. Any pain when I touch? I was looking, not touching prior, sorry. Any pain when I touch?
No.
Okay. And then I'm going to go down your leg. Any pain or tenderness here in the calf and down to the ankle?
No.
No? Okay. Great. And then I'm going to assess your range of motion. So I'm going to have you stick your leg out. Perfect. Okay. And then down, then bend your ankles back and forth, and your toes flex and relax. Great. Okay. Range of motion to the knees, ankles intact. I'm going to check your reflexes now while I have you sitting. Check your knee here. All right. 2+. 2+ noted. And then while I'm down here, I'm going to check your Achilles reflex. I'm just going to support your toes in an upward position and have your Achilles exposed. Try to relax. All right, 2+ to the right. Same with the left ear. Support your toes. Okay, 2+. And then I'm going to do your plantar reflex by assessing your Babinski. I'm going to support underneath your leg here. One more time. All right, toes curled inward, negative test. All right, toes curled inward, negative test. Great. And then we're going to assess for dystaxia before we stand up. So I'm going to have you take your right heel into your left knee and then go down. Great. And then the other side. Great. No dystaxia noted. And before we stand up, I want to just go over the different sensations. Exteroceptive sensation is the patient's ability to assess or to verify pain or temperature. To measure this, to measure pain, you would take like a safety clip or something that has a dull side and a sharp side. You could use like a Q-tip that has a soft side and then a sharp side on the end. And then you're going to have them close their eyes and you're going to just touch the limbs with the dull or sharp side and have them identify what side you're touching them with. And then to test for temperature, you would do ice cubes and warm water. Ice cubes and warm water, and you would touch this patient's skin in different areas while their eyes are closed and have them identify if it's warm or ice that's touching them. To do proprioceptive sensation, proprioceptive sensation is the patient's ability to distinguish between or to verify their body in motion and their position and vibration. To verify motion, you would have them close their eyes and you would perform a range of motion on an extremity. And they would open their eyes and they would demonstrate that range of motion back to you or verbalize what you did. And then to do position, you would have them close their eyes. You would place their arm or their leg in a certain position and then relax it and then have them open their eyes and again, either demonstrate or verbalize the position that their extremity was in. And then to do your vibration, you would use the tuning fork. You would activate it and then position it against a bony prominent area like the elbow or sternum, and then have them verify the ability to feel the vibration. For cortical sensation, you would want to test for them to be able to distinguish between two different sensations. So you would assess the, or excuse me, yeah, you would do the graphesthesia, gosh, and then that would be where you would take their palm, have them close their eyes, and you would either draw a symbol or a letter in their palm and have them identify it. Stereognosis is where you would have them close their eyes and you would put an identifiable object in their hand and then see if they can identify it, like a pen or a key. And then to do the 2 points of discrimination, you would take something like sharp that has 2 teeth on it, like tweezers or something, and have them close their eyes, and then you would touch the skin with either one or both of the sharp sides, and then you would see if they could tell you if you were touching them with 1 or 2 to be able to distinguish close proximity pain or sensation. And then to do 2-point discrimination and then your extinction, you would either have them close their eyes and tap the knees, or you can stand behind them and do the shoulders and then have them look straight ahead and then have them verify which side of the body you're touching or if both. And that would measure the extinction. Okay. But we're gonna have you stand up at this point, and I'm going to check your balance by assessing the Romberg's test. So I'm going to have you put your arms out in front of you. And then I'm going to just kind of position myself here just in case you lose your balance. And then I'm going to have you invert your palms upwards and then close your eyes. Great, no swinging noted, no loss of balance, okay. And then I'm going to assess your gait for ataxia. So I'm going to have you start over there, sorry. And then you're going to walk towards me normally. Great, no ataxia noted, no swaying. Turn around and I'm going to have you walk on your tiptoes. Great. And then back, I'm going to have you walk on your heels. Great. And then toe to heel. Great. No excessive pronation or supination noted in the knees or ankles. I'm going to have you come towards me and then just turn around. I'll note that your shoulders are symmetric. There's no kyphosis or lordosis noted. I'm going to have you raise your arms up over your head and then bend forward, and I'm going to assess your spine here. All right, perfect, no curvature noted. And then on your way up, I'm just going to kind of palpate, and you tell me if there's any tenderness. No. Any tenderness or pain anywhere here? No. Okay, no bulging noted. And then while you're standing, I'm going to have you just bend to the right and then bend to the left. Great, spinal range of motion is intact. All right, you can have a seat. That concludes our wellness exam. Do you have any questions for me? No. All right, great. So like I said, the MA will do your acoustics testing now. So I'm going to step out and get your discharge report going. Okay, great. Thank you for stopping by.